I'm Dr. Elizabeth LeBrun. I practice medicine at Blount Memorial Hospital since September of 1991. I've recently retired, and I haven't quite decided what I'm going to do with my retirement. I wasn't raised from a medical family. That my dad was a factory worker, my mom was a stay-at-home mom, she had 5 kids, and anyone who has kids knows that's really a full-time job. And even though medicine wasn't in my family, I always felt called to it. And I want people to understand that if they have that feeling, whether their family is in nursing or they've even seen nursing or been in a nursing situation, to follow it through, because sometimes you don't know where that path is going to lead you. For me, it led me into medical school, and I never ever would have thought I would be a doctor. And having been a nurse gave me the courage to finish my BS degree and apply to medical schools and become a doctor. And then it became, well, what kind of doctor do I want to be? And I think OB-GYN for me sort of encompasses everything that I was already trained to do. Oh yes, I've seen a lot. In fact, when I first came, the first medical office building was just being built. And now we have the second and the cancer center and this beautiful garden that we're here now. Many of the floors of the hospital have been done over and over. I know labor and delivery, where I worked many years, has been redone at least 4 or 5 times. I think nurses are really on the battlefield of healthcare. The nurses in the emergency room, the nurses in labor and delivery, the nurses on the floor when a new patient is admitted, someone in ICU. This is really the battleground of healthcare. Who stays with these patients? 8 hours, 12-hour shifts, constantly. It's the nurses. And so I decided on my birthday this year, which was March the 3rd, to start 2 scholarships in Blount Memorial. And this will be for nurses, LPNs, nursing assistants, or RNs. They can be nurses who are already in a program or just going to be entering the program. I thought this was a way that I could give back to Blount Memorial for having given me the opportunity to practice here all these years. Basically, Blount Memorial has been my life and my family. And I've just loved all my experiences with everyone here, from the administration. Mr. Dawson was wonderful, and now Mr. Heineman. They've always been good to the medical people, from the physicians on down, and I just really feel like part of the family. And when they say close to home, this really is close to home.